See if we can see this moon here. All right, it's a nice even number. Day 20, actually just a little past 5 a.m. So I'm pretty stoked because I feel good. I was tired when I woke up, but had a small cup of coffee, little espresso. I'm gonna get this done. 20 minutes, day 20. Today's topic on day 20, hopefully don't wake up the neighborhood, is are you injured or are you hurt? So what is hurt? Well, in the words of James Caan from the program, hurt means you can play, injured means you can't. When it comes to running or any kind of repetitive sport, especially low impact, you know, how do you know if you're injured or you're hurt? Well, one of the common hurts is foot pain, knee pain, ankle pain, hip pain, whatever. And the thing we have to understand is unless we have a pre-existing mechanism of injury or something that happened long ago within a mechanism of injury that actually damaged tissue, and you know definitively it damaged tissue in the sense of an acute injury where there might have been a tear or a sprain. Well, a sprain could be a tear of a ligament, a strain, tear of a muscle, whether it's small or big. That's why they grade these things 1 through 4, 1 through 5, whatever it is. So the thing that happens is, say we're just running through a little bit of pain, running through a little bit of discomfort, and shit pops up. Again, this is excluding you have some titanium plates, you're pulling you down, and screws in your body that's pulling your pelvis off and making pain excruciating. Excruciating pain is like, hey, you know what, you're injured. But if you can go constantly for runs or walks or low impact cycles or HIIT workouts, and you just have some nasty tightness, you know, something that's like really gripping you for a little bit, but it goes away, I wouldn't ignore it. But that's just being hurt. You're not injured, you're just hurt. There's a nice spot to roll out right here. Right on those, right in that quad group. Which ties nicely right into where iliopsoas crosses over and inserts on that inside of that hip. So you can get in there and roll right across that area. You can stay more on the outside, that outside of that glute muscle. And all those muscles that tie in right around the hip bone. You can get right in there. It feels very good. Those are usually locked down and real tight. So what would that look like from this side? Right in through there. You go right down. You gotta get it on the quad group though. Don't ignore the quads. All the way down. Now, this is very hard in the beginning. That can be real tender early on in the process. See that? You gotta get out here like this. Oh yeah. You can put more weight on it by resting the top leg. You can offset it by using the foot to brace you up like this. You gotta find the tender spots though. That tender spot is tender for a reason. See here, but very minimal. All we're doing is rolling up the fascia, changing the sensitization to that area. Keep the glutes one foot over the other, just to get in on the tender spots around that piriformis. It's really not much. Most of the rolling really occurs here. That's where the action occurs. I don't feel that it's especially effective for the posterior chain, but nevertheless, every bit as necessary when we're talking about muscles that have been contracting, and overactive. And I'm just going to use this. I'm going to use this moment in this video to kind of share with people something a lot of my patients, right? So majority of the people I see for lower back pain, and their lower back pain, a majority of the time comes from an injured disc. So I'm going to use this video to give you a quick tip. Now, if you actually have a history of an aggravated lower back lumbar disc, or if you think you do, or someone diagnosed you with one, or you've been to my office and I told you to watch this video, what I want you to do is see the position I'm in right now. I'm just lying flat on my stomach, and my rear end, okay, is passive. Like, it's just totally turned off. It's not activated. See, like, now I'm activating my glutes and I'm raising my core. Now, in an acute back situation, you need to find yourself in a position like this. Now, this position might actually look like this, where you're lying on the floor. Completely passive, completely turned off. What I like for people to be able to finally do is get themselves in a position where they're like, hands over here. And again, this whole lower body just turned off like this. See, wiggle in the butt, completely turned off. Now what you do is you need to be able to decompress that area. You need to be able to decompress this area. You need to decompress this. How do you do that? Pull your elbows in. You just pull your elbows in. Don't contract the lower part of your body, just let it relax. And you need to use this pose until it feels a little easier to be able to get up, one leg at a time. And in that situation, again, acute back injuries. This means like you really hurt your back. You probably bent and turned wrong. You sneezed at the sink and then your back went out. Those situations, you need to be able to come to that position on the stomach like that until you find that comfortable tolerance. If that can't occur on your stomach, then you need to go on your back with your feet up. That second option looks like this. Imagine a chair over here or something to bolster your feet up, or bolster to put under your legs. Again, totally passive. You're not going into a sit-up position. Just imagine that you're here resting like this until you can come to a spot that's comfortable and pushing yourself up. So I'm attaching this for those people out there that have acute back injuries. Now remember, I'm pretty familiar with back pain. It's sort of the motivation behind a lot of this. And I highly recommend that those two positions is what you need to be able to come to where it becomes tolerant in that position to then move around. One of those two ways is the only way you're gonna get the disc to calm down a little bit and even have room to be able to move around, to be able to get adjusted, to be able to ice, be able to rest, and be able to heal. So there it is. Rolling, what to do in an acute back situation, day 20 in the books. Now it's time to refuel and get ready. Until next time, everybody. Hopefully Nurse Jen didn't wake up and get mad at me. It's Dr. Proman.